Bismillahirrahmanirrahim. Assalamu alaikum. My name is Bushra Mubarak and I am working as an assistant professor at the Department of University Institute of Medical Laboratory Technology, Faculty of Allied Health Sciences, the University of Lahore. Today my topic of discussion is hypersensitivity 1, which is an important topic in immunology. Before discussing hypersensitivity 1, let's start with the hypersensitivity. What is hypersensitivity? Basically, hypersensitivity is an aggregated or inappropriate immune response that may result in harmful reaction against human. Like it may activate humoral and cell-mediated immunity. And there are 4 types of hypersensitivity reactions. Type 1 is IgE mediated hypersensitivity. That means IgE antibody will mediate this type of reaction. Type 2 and type 3 is antibody mediated, but IgG class of antibody is involved in these 2 type of reaction. And last one, which is type 4 hypersensitivity reaction, is cell mediated hypersensitivity. When we will discuss hypersensitivity 1, let's start. An immediate hypersensitivity reaction is called type 1 hypersensitivity, or it also called IgE mediated hypersensitivity reaction. When an antigen or allergen enter into the body, immune system will act as a inappropriate response and it will cause hypersensitivity, which is type 1 hypersensitivity, and it results in activation of mast cells with degranulation of mast cells and basophils and release vasoactive mediators which cause tissue damage and different type of hypersensitivity reactions. Now let's start. What is allergen? Allergen is non-parasitic or any substance which is non-parasitic antigen, or that antigens which can stimulate type 1 hypersensitivity reaction. It stimulates IgE type of antibodies and mast cells and basophils degranulation. This is the mechanism of type 1 hypersensitivity. When an allergen, which includes pollens or dust or food particles or any protein like egg protein or seafoods, fish, peanut, or any type of allergen which is normal for 80% of population, but the remaining 20% of population will respond to that specific allergen and cause hypersensitivity. When this allergen enter into the body, APCs will activate, which engulf that allergen and start digestion of this specific allergen and present part of that allergen with MSC class 2 to helper T cell. Helper T cell 2 is the main key cells in this type of reaction, and helper 2 cells then secrete cytokines like interleukin 4, interleukin 5 and interleukin 13, which will activate B cells and class switching of B cells. When B cells will activate, it will differentiate into memory cells and plasma cells by interleukin 4 and interleukin 5. After plasma cells will secrete IgE, and IgE will attach with receptors, Fc receptors, which is called Fc epsilon receptor type 1 and type 2. These receptors are present on the surface of mast cells and basophils, and IgE will react with these receptors and attach on the surface of mast cells and basophils. This is first exposure. When allergen first time enter into the body of any children or any people which is hypersensitive. After first exposure, after 2 or 3 months, when allergen enter into the body, second time, this allergen will cross-react or cross-link with the IgE antibodies which is present on the surface of mast cells and basophils. And when this cross-linking will occur, it will degranulate mast cells and basophils. Means the granules inside the mast cells and basophils will start degranulation, and vasoactive amines and vasoactive mediators will release from mast cells and basophils, which will act on different types of tissues and cells and start hypersensitivity. Vasoactive amines will react on smooth muscle cells, will act on smooth muscle cells and cause smooth muscle cell contraction. It will act on blood vessels and cause vascular permeability, increase in vascular permeability. It will act on mucus gland and cause increased mucus production, hyperactivation of mucus gland. It will act on blood platelets and cause aggregation of platelets, and it also act on eosinophil and cause recruitment of eosinophil in the tissue where hypersensitivity reaction occur. These are different types of mediators like histamine, heparin, which will act on increase in vascular permeability and cause smooth muscle contraction. Serotonin, which is also act like histamine, but it is less strong as compared to histamine and act same like histamine. There is also a mediator which is called primary mediators. Primary mediators means these mediators will release immediately and cause immediate phase of reaction. There is also primary mediators like eosinophil chemotactic factor, neutrophil chemotactic factor, and these factors will increase recruitment of eosinophil and neutrophil at the site of hypersensitivity. There is also secretion of proteases from granules and cause destruction of tissue cells, proteins, and complement activation products. There are some mediators which is called secondary mediator. That means these mediator will release after some time, after a lapse of 2 to 6 hours. Secondary types of mediator will release, which is also called slow acting mediators, and these mediators include platelet activating mediator, which is involved in platelet aggregation. There is also two important mediators, leukotriene and prostaglandin, which is very important in secondary reactions, like which is very important in delayed type of reaction. And there is also involvement of bradykinin, and there is also secretion of a number of cytokines which include interleukin 1, TNF alpha, interleukin 4, 5, 13, and more cytokines which will again increase the production of B cell, increase the activation of B cell, increase the proliferation of B cell, and increase the IgE production. These two types of mediator, as I told you earlier, this cause two types of reaction, two phases. First phase is immediate phase, which start from 30 seconds and end in 30 minutes. This is first type of response after when a hypersensitivity reaction or attack will occur. After 30 minutes, first type of reaction will be reduced, and after 6 hours, a new type of reaction, a new attack will occur, which is called late phase or delayed phase of reaction, which will be end at after 2 days. There are different types of hypersensitivity diseases, or which is called clinical manifestations, which is included in hypersensitivity 1. These are classified into two types, local and systemic. In local anaphylactic reaction, there are different organs which is involved and cause a specific type of disease. And in systemic anaphylactic reaction, there is increased degranulation of mast cells within minutes, and it causes death even a person which is hypersensitive. In local type of reaction, there are different involvements of organ. If lungs are involved, then it will result in asthma, and it will be due to some allergens like pollens, house dust mites, danders, and airborne allergens. If nose and eyes are involved, there are some reactions like rhinitis or conjunctivitis, or if both reactions will occur, conjunctivitis and rhinitis, it's called hay fever. If skin is involved, there are two types of reaction like urticaria and eczema. Urticaria is also called hives, and eczema is also called atopic dermatitis, and it is caused by drugs or various foods which is entered into the body, and it causes hypersensitivity reaction. This is the membrane in asthma patient, lung membrane, lung epithelial cells, which is activated by different mediators which is released from mast cells and basophils, and these mast cells and basophils will be present in lungs if there is inhalation of any allergen like pollen, dust or any food particles, and it will involve respiratory tract, then bronchial asthma will result, and there is hyper secretion of mucus, smooth muscle contraction, vascular permeability will be increased, and there are more inflammatory cells at the area where hypersensitivity reaction occur. In case of asthma, it is lung epithelium. This is the picture of urticaria and eczema. Urticaria is simply rashes, hives due to some drugs or due to some antigens or allergen which is enter through the skin. Type 1 hypersensitivity is diagnosed by different methods. First method, which is very common in last decade, is skin prick test. And now in vitro diagnostic test is present, which is radio allergosorbent assay, which is also called RAS. It is also called RIST in the name of radio immunosorbent assay. And IgE antibodies can also be tested or can also be measured by ELISA method, and total IgE or allergen specific IgE can be measured by both methods, RAS and ELISA. This picture shows skin prick test in which a small amount of allergen will be injected into the skin. These allergen will be common allergens like pollen, dust, house dust mites, to check to which allergen person is hypersensitive. And then this small amount of allergen cause wheal and flare reaction. If there is presence of wheal and flare reaction at that area where antigen will be injected, it will show this allergen is positive or this person is positive for that specific type of allergen. This allergen will be injected at the back of a person or at forearm of a person with different type of allergen in small amount, and when there is wheal and flare reaction in any type of allergen, it is called positive for that allergen. Second method which is used for diagnosis of hypersensitivity reaction means we will check total IgE or allergen specific IgE by radio allergosorbent assay. In this assay, allergen coupled to solid phase, a solid particle will be used on which allergen will add, and after that patient serum will be added in this specific type of solid particle. When patient have specific type of IgE against that allergen which is coated on the surface of solid phase, then it will attach with this solid phase allergen, and after that washing step will be performed, through which all the non-specific IgE will be removed from the serum. And after that, second antibody which is called radio labeled anti-IgE antibody which is against human IgE will be added, and if there is some IgE which is attached with solid phase, it will cause binding of anti-IgE to that IgE which is already attached and cause positive reaction, and there is radioactivity. If there is radioactivity, that means positive reaction is occur. ELISA method will also work on the same principle but on microtiter plate. Now last is what is the treatment of type 1 hypersensitivity. Type 1 hypersensitivity can be controllable or can be preventable, but by different means. We can avoid allergen. Means if any person is allergic to pollen, he should avoid to the pollens by wearing mask, or if any person is hypersensitive to dust, he can wear a mask, or he can avoid that places where there is increased level of dust. We can also prevent hypersensitivity reaction by immunotherapy. Immunotherapy is a method which in which hyposensitization can occur. In this method, for treatment of patient, large doses of allergen is injected into the person, and it will cause production of blocking antibodies which can block IgE of binding with mast cells. And there are several drugs which is used for treatment of different types of reactions, different types of hypersensitivity 1 reaction. In this include different drugs which is used for blockage of mediator, which is used for blockage or prevention of degranulation. For this, there is antihistamine, and antihistamine is used to block the target cells where histamine will act, and it causes prevention of first type of reaction like immediate phase of reaction. Chromonyl sodium is also used, which is used for blockage of calcium or calcium entry into the mast cells, because for degranulation mast cells and cyclic AMP is very important. If there is deficiency of mast cells or there is increased level of calcium AMP, cyclic AMP, it will cause prevention of degranulation. Chromonyl sodium is used for blockage of calcium into the mast cells, so there is no degranulation. Theophylline and epinephrine is also used for treatment of hypersensitivity, and in this type of drugs, it can increase the level of cyclic AMP, and cyclic AMP will swell the granules but prevent degranulation. Granule will swell by increasing cyclic AMP, but there is no lysis of granules. Corticosteroids is also used. Corticosteroids will block production of leukotriene and prostaglandin, and it will reduce inflammatory phase, which is called delayed phase or late type of phase. That's all for hypersensitivity 1. Thank you for listening.